My name is Deacon Carpenter, and I'm an Ayurvedic practitioner and wellness counselor with Daily Veda. Today's module will be discussing rheumatoid arthritis from the Ayurvedic perspective. Now, when we look at rheumatoid arthritis from the Ayurvedic pathogenesis perspective, it points to a Vata imbalance in the digestive system. Now, Vata is a combination of space and air, which are classified as being light, mobile, and expansive by nature. So Vata is light, mobile, and expansive by nature, and therefore governs movement in the body. So functions like blood circulation, efferent nerve impulses, even the act of getting food through the digestive system is governed by Vata. But Vata actually plays a very big role in the small intestine. It's Vata's job in the small intestine to make sure that all toxins that come into the system from the food that we're eating are separated from the nutrients that will become tissues. So if Vata isn't functioning normally, those toxins will actually hang on to the nutrients, pass through the manufacturing, or pass through the manufacturing process of the small intestine and become tissues. And those toxins will go deeper and deeper into the tissues depending on how Vata is functioning in the small intestine. Remember, the small intestine is where most of the digestion and assimilation process happens. So, we have Vata that's misbehaving in the small intestine, and these toxins are now deeper into the body. It could be in our blood, could be in our bone, it could be in our muscle or fat. What happens with this, when we're talking about rheumatoid arthritis specifically, we know that it goes to the joints. But of course, our body tries to counteract that. We have Pitta. Pitta governs all digestion in the system because it's a combination of fire and water. So what happens is, Pitta sees the toxins go through the small intestine and says, okay, I'm going to go after that and try and metabolize it. So by the time the toxins have hit our joints, Pitta is now trying to attack the toxins in the joints, causing inflammation because the digestive system hasn't been recalibrated. The Vata in the small intestine is still functioning incorrectly. So with rheumatoid arthritis, what's happening is you've got toxins in the joints that are trying to be digested by Pitta, which is where the inflammation comes in. Now, what happens when the body gets attacked? Well, it tries to protect itself. So Kapha now comes into play, Kapha being a combination of water and earth. And anytime we get hurt physically, let's say, for example, we get a bruise, or let's say, for example, we get some sort of swelling because some sort of sports injury that we get. Kapha is now trying to protect the joints from Pitta metabolizing it. So now not only do you have inflammation in the joints because of Pitta trying to metabolize the toxins, but you now have Kapha, which is trying to protect the joint from Pitta. So it really does include all different doshas in the body when it comes to rheumatoid arthritis, and we'll get into some of the specifics in just a few slides. So here we have a side-by-side comparison of two different patients. You can see from the x-ray of the hand on the left that the patient here does not suffer from rheumatoid arthritis. The carpal bones are clustered normally, and there's no swelling in the metacarpal phalangeal joints. Looking at the x-ray of the hand on the right, you can see that the carpal bones here are clustered rather incongruently. You can see that there's swelling there, and even in the metacarpal phalangeal joints right here, you can see that there's swelling and deformity. So this is someone who has more of a mid to late stage of rheumatoid arthritis in their joints. So us Ayurvedists call the digestive system the inner disease pathway. And the reason we call the digestive system the inner disease pathway is because we truly believe that the digestive system is our first line of defense when it comes to disease prevention. We believe that if your digestive system is functioning optimally, your metabolism will function optimally. So any pathogen that comes into the body can be easily digested and will prevent disease. But interestingly enough, in Ayurvedic medicine, we believe that digestion doesn't start in the stomach, as most people do. Disease starts in the mouth. It's interesting, a lot of my clients, some of them who have gastric issues, some of them have hyperacidity, when I ask them about their diet or how they're eating, they could be eating some incredibly wonderful organic foods, but what they're not doing is eating the food efficiently. They're either having lunch, sending an email, or they're having lunch on the telephone, or they're watching television when they're having dinner, or they're even driving a car to their next meeting when they're having lunch. So what we're trying to do is get as much food into our system as possible, so we don't chew our food very much. But remember, in the mouth, the body excretes saliva and other pre-digestive enzymes that allows the food to be broken down much more efficiently. So by the time it hits the stomach, the body knows exactly what to do with it because it's been masticated properly and there are enzymes that have been pre-digesting it. So obviously from the mouth, then we go through the esophagus. The esophagus takes the food to the stomach, and then it hits the stomach where those lovely gastric juices are at play. And you can barely see the gallbladder here, but there it is. The gallbladder stores bile that's produced by the liver and then excretes it into the digestive system to break down fats. Then we have the liver. As you can see, it's quite a large piece of the digestive system. Of course, the liver is the largest organ, actually, inside the body. It makes the bile, which helps to break down fats and gets rid of waste in the body. And it changes food into energy, cleans the body of alcohol and any other toxins before it hits the blood. Then we have, you can't really see the pancreas, it's this little yellow guy right here, which goes up behind the stomach. Pancreas is a gland that makes the enzyme insulin, and we know that insulin is the enzyme which helps the body turn food into energy. Then we have the small intestine. Like I said, that's where we have all of our, the powerhouse of our manufacturing of our tissues happens in the small intestine. And then you've got the large intestine, which is really where the large intestine absorbs water and sodium from the stool. You've got the appendix, and no one really knows what that little guy is there, what it does there. And then you have the rectum, and you have the anus, which is where we have the releases toxins. But the reason I want to show you this slide is because it's very important to remember that our digestion starts up here in the chops. I mean, always be mindful about the sort of food you're eating, how you're eating it, when you're eating it, and make sure you're chewing it enough. So the next thing I wanted to focus on are the subdoshas of Vata, Pitta, Kapha as they relate to the pathogenesis of rheumatoid arthritis in the body. Now, for those of you who don't know what a subdosha is one of 5 specific locations of the body that specific dosha lives. And each of these subdoshas is governed by a single element. So let me explain. Samana Vata, Samana Vayu. Samana is Sanskrit for balancing. Samana Vata, Samana Vayu lives in the small intestine. Now, in Ayurvedic anatomy, everyone knows that Pitta governs digestion in the small intestine, but you need Vata to push the nutrients and push the process along. So, Samana Vata helps to push the digestive process along in the small intestine, and as I mentioned earlier, this is the job of Samana Vata to separate the toxins from the nutrients before they become tissues. Now, as I mentioned, each of these subdoshas is governed by a single element. So, because the small intestine is the seat of Pitta, Samana Vata is governed by fire. That's its governing element. Interestingly, not space and air, but the governance here is fire. It helps with the digestive quality. The other subdosha in the pathogenesis of rheumatoid arthritis is Vyana, which is diffusing. Vyana means diffusing in Sanskrit, Vyana Vatu or Vyana Vayu. Remember earlier I said that Vata is a combination of space and air, which by nature is mobile, light, and expansive. Well, that's what I mean. It's expanding and it's mobile through the body. It's circulating through the body. So its main seat, its home, is the heart and the whole body. So anytime you're thinking about Vyana Vatu, it's the circulation of the blood, it's the circulation of the nerves. That's where the Vyana Vatu lives. So therefore, the governing element is water, because you need water to carry that movement. And the functions of the Anuvatu are circulation of prana and blood throughout the body and flow of water. So just think of the circulatory system. So just to recap the pathogenesis of rheumatoid arthritis as it relates to Vata dosha, I've combined the two subdoshas into this one little banner here. And as I mentioned, if Vata is misbehaving in the small intestine, what happens is toxins that were supposed to be removed from the nutrients become part of the tissue and go deeper into the body. The Sanskrit name of toxin is ama, A-M-A. And in the case of rheumatoid arthritis, the toxin is clearly on the joints. Pitta tries to go in and digest the toxins on the joints but causes inflammation. And Kapha tries in to go and protect the joint, causing it to swell. So we have inflammation, we have deformity and dysfunction and pain. Next, we have the subdoshas of Pitta, which play a role in the pathogenesis of rheumatoid arthritis. The first one is Pachaka Pitta. Pachaka basically means fire of digestion in Sanskrit. Now, Pachaka Pitta does all the heavy lifting when it comes to digestion and assimilation. Vata moves it along, but Pitta goes in and breaks things down. So Pachaka Pitta lives in the small intestine and sort of the lower half of the stomach here. Because it is digestion, the governing element here is fire. And like I said, it digests the food and it regulates body temperature. Next one is Ranjaka Pitta. Ranjaka Pitta lives in the spleen, which is right here behind the stomach, and the liver, which is being obscured by the large and the small intestine there. It also lives in the blood. So because of that nature, the governing element is water, and its functions are to produce bile, liver enzymes, and blood. That's the function of Ranjaka Pitta. So quick recap on the Pitta subdoshas as it relates to the pathogenesis of rheumatoid arthritis. Rajaka and Pajaka Pitta try to go to the joint to metabolize and digest the toxin. Unfortunately, they're not able to do their job efficiently and they cause inflammation on the joints. Now let's look at the subdoshas of Kapha as they relate to rheumatoid arthritis. And interestingly enough, you'll notice that we have 3 subdoshas with Kapha versus the 2 we saw with Vata and Pitta. So when you think of Kapha, I want you to think of it as being the body's protector. Anytime we're hurt physically or emotionally, Kapha comes to the rescue and gives us a hug, either by swelling in the area that we've hurt ourselves or making us want to eat some ice cream to kind of make us feel better. That's what Kapha does. It's the big softie. Very paternal is old Kapha. So we'll start with Kledaka Kapha. Now Kledaka in the system, its primary function in the stomach, which is where it lives, is to protect the stomach lining from the gastric acids that are produced in the body. So therefore the governing element of Kledaka Kapha is fire. Of course, if we didn't have that lining provided to us by Kledaka Kapha, then gastric acid would leak out of our system and cause all kinds of problems. The next subdosha is Avlambaka. And Avlambaka protects the lungs. It's a bit like managing the mucus in the lungs to prevent the lungs from drying out. It also lives in the heart. It has to do with circulation. So the governing element here is air. So primarily, Avlambaka Kapha protects the lungs from drying out. And then lastly, there's Shlesaka Kapha. Now, Shlesaka Kapha protects the joints. This is sort of where it all comes into focus now. So we're talking about pitta aggravation, we're talking about pitta inflammation in the joints, specifically with rheumatoid arthritis. So the swelling we get from rheumatoid arthritis is governed or is kind of led the charge by Shlesaka Kapha. Its governing qualities or governing elements rather are earth. If it's functioning normally, it lubricates and protects the joints. So again, thinking about the pitta inflammation, trying to metabolize the toxins in the joints, is causing a swell by Shlesaka Kapha. So quick recap on the Kapha subdoshas as they relate to the pathogenesis of rheumatoid arthritis. The 3 subdoshas protect The three subdoshas of Kapha protect the body from drying out, burning up, or not moving properly. So what happens with Kapha as it goes to respond to the Pitta inflammation in the joint is that we get swelling. So if you see a patient with rheumatoid arthritis or with arthritic joints, the swelling and the deformity of the hand is caused by a combination of the inflammation from the two subdoshas of Pitta and the protective quality of the three subdoshas of Kapha. So I get a lot of questions about how tissues are produced in the body from an Ayurvedic perspective, and this slide really does spell that out quite nicely. You'll see that there are 7 physical tissues that are produced in the body, but there's one that's more esoteric. So we believe in Ayurveda there are actually 8 tissues that are being produced. That last tissue is called Ojas. Ojas is a very sacred tissue, and it's what supports our well-being at the most rudimentary level. So in Ayurveda, in the small intestine, as tissues are being produced, it starts with plasma, then it's blood, then it's muscle, then it's fat, then it's bone, then it's nerves, and then it's the sexual tissues of the ovum and sperm. And it goes in that order. So, of course, Vata, if it's not monkeying around, as it sometimes does, if it's functioning normally, then what's happening is the tissues are being produced and all the toxins, or ama, are being removed. However, if Vata is misbehaving, as these different tissues are being made in order and ama isn't separated from the different tissues as they're being produced, it increases. So ama from plasma goes into blood, and now you've got the ama from the plasma and blood that goes into the muscle tissue, and then you've got the ama, or the toxin, from plasma, blood, and muscle going to the fat tissue. So you can see if toxins aren't removed from the system as the tissues are being produced, it can affect a lot more tissues than just 1 or 2. Before we get into some of the therapies that we use in Ayurvedic medicine to treat people with rheumatoid arthritis, just a couple of quick disclaimers. The first one is, of course, anytime you're working with any Ayurvedic therapy, make sure that you're under the guidance of a qualified Ayurvedic practitioner. And really, most importantly, is always make sure that you double check with your primary care physician before embarking on any complementary alternative therapy. They can tell you if there'll be any contraindications with medication or any other therapy that you're working on with them. So the most important thing we can start with in Ayurvedic medicine is, of course, the diet. So we have a lightening therapy. A lightening therapy is a light diet which helps to eliminate toxins in the system, and that diet is based on the primary dosha of the patient with rheumatoid arthritis. Next is a local dry heat therapy, and that's just simply a heating pad that you can plug in and apply to the joints for up to 20 minutes a day. It helps to reduce the swelling and some of the pain caused by rheumatoid arthritis. A bit more intensive here is Virechana, and Virechana is purgative therapy in Sanskrit. And what we do in Ayurvedic medicine with Virechana, under the guidance, of course, of a qualified Ayurvedic practitioner, is take castor oil for 40 days. And usually we take up to 4 teaspoons of castor oil for 40 days in conjunction with the lightning therapy, which helps the body to release toxins. And the Virechana actually helps to eliminate toxins in the joints at the source. Triphala means 3 fruits, and Triphala helps to rejuvenate and restore the elimination process of the body. So it actually helps to gently remove toxins from the system. There are various Ayurvedic herbal formulas, specifically with ingredients like sweet fennel, ginger, senna, black pepper, and guggulu. These are based on the different constitutions of the patient. So if there is a specific need, then the Ayurvedic practitioner can recommend different guggulus and different herbal therapies to focus specifically on the rheumatoid arthritis as it affects the patient. Medicated nightly oil massage. Using sesame oil, there are oils out there that are to balance Vata, Pitta, and Kapha. Just gently massage the joint where it hurts. The longer you massage the joint, the deeper the oil will penetrate into the skin, into the joint, which will alleviate some of the inflammation and pain that you experience with rheumatoid arthritis. Hot water therapy is really much like Virachana in the sense that if you're sipping hot water every hour, maybe three-quarters of a cup of hot water every hour, that can actually help to increase the metabolic fire and reduce toxicity in the system. It's really fantastic for patients who have a Vata or Kapha constitution, but if someone is mostly Pitta, of course, it's too much heat, so we recommend using warm water instead. A regular routine, so going to bed by 10 o'clock and rising before 6:15 in the morning. When our bodies are natural rhythm, it can tend to be more balanced that way. Really good advice for people who've more of a Vata constitution. And lastly, yoga asanas to pacify the patient's primary dosha. Yoga asanas are very important to stretch and move the body, especially with the joints. And if it's in conjunction with some of these Ayurvedic therapies, it's really beneficial to help bring the joints back into balance. Thank you for joining me on this module about rheumatoid arthritis from the Ayurvedic perspective. We look forward to seeing you at other modules again.